There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The three main causes of hypertension are change in the content of blood, an increase in the amount of blood and/or narrower blood vessels. Let's go over each in detail. Show the blood content changed. Turn the color of some molecules to blue or something. The changes in the content of blood can affect its fluidity, or in other words, its thickness. When the blood becomes too thick, it gets hard for it to circulate through the vessels efficiently. This causes the heart to squeeze harder to send the blood to the extremities. When the heart pushes harder, blood pressure automatically increases. The content of blood changes due to fluctuation of cell concentrations or taking several medicines. 2. An increase in the amount of blood. Show that there are too many molecules of blood in the vessel. Sodium from salt increases blood volume. When there is more blood to pump, your heart will have to work much harder. Therefore, pumping blood with more force will increase the blood pressure. When you eat salty foods, sodium enters the blood vessels. To equalize the sodium concentration, the vessels draw water from the tissues, leading to an increased volume of blood. A4. Show increasing size of blood vessel due to increase in blood. 3. Narrow blood vessels. Show that the blood vessels have narrowed. When your body is under stress, it responds by releasing certain stress hormones. Amongst the many functions of these hormones, one of their functions is to signal blood vessels to constrict themselves, that is, narrow down in diameter. When the blood vessels lose their diameter, it makes the area for the blood to flow through very small, which again causes an increase in blood pressure. A5. Show size of blood vessels decreasing. Other reasons that cause a high blood pressure include alcohol abuse, sedentary lifestyle or inactivity, smoking, obesity, and underlying medical conditions such as congenital heart diseases or kidney disorders. Generally speaking, hypertension is classified as either primary or secondary. Primary hypertension is defined as high blood pressure in which secondary causes are not present. Most people with high blood pressure have primary hypertension, as it accounts for about 90% of all cases. Secondary causes include kidney problems, medications, breathing problems, sleep apnea, tumors, oversecretion of hormones, etc. In some cases, your doctor will decide on screening for these causes. Remember that clinical diagnosis of hypertension should be made by a healthcare professional. You should visit your primary care physician and decide on clinical investigations and treatment plan. For better communication with your doctor, use our new application, My BP Blood Pressure Tracker. Click here to check it out. Medical disclaimer equals 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 information. Do not use the information as medical advice. The information is not a substitute for medical advice. No warranties or representations are given in relation to the medical information. Please consult your physician if you have any questions about any medical matter. Essential hypertension or primary hypertension are the most common form of hypertension. Almost 95% of the hypertensive patients have essential hypertension. It is idiopathic. Cause not identified. Though it is idiopathic, but there are some factors which increases the risk of having hypertension: family history, genetic predisposition, environmental factors, obesity, aging, sodium sensitivity, due to high salt intake, alcohol and tobacco. 4. All NCDs: sedentary lifestyle, race, African more prone than white, others like hormonal imbalance, renin elevation, metabolic syndrome like diabetes, vitamin deficiency, etc. Hope this will help. High blood pressure, also known as hypertension, is defined as the force exerted by the blood against the walls of blood vessels, and the magnitude of this force will depend on the cardiac output and the resistance of the blood vessels. The exact causes of high blood pressure are unknown, but there are several factors and conditions that may play a key role. Family history of high blood pressure, genetics, overweight or obesity, lack of physical activity, excessive salt intake, too much alcohol consumption, smoking, stress, older age, chronic kidney disease, adrenal and thyroid disorders, sleep apnea, pregnancy, birth control pills. High blood pressure, hypertension, is a silent killer which quietly damages the body for years before the onset of any of its symptoms. If left uncontrolled or untreated, it can cause disability, poor quality of life, or even a fatal heart attack. Hence, regular checking of your various parameters is important to keep all complications at bay. Hope the above information was helpful for you. To know more, read Does Hypertension Haunt You Too? Primary hypertension, chronic high blood pressure mostly not associated with another disease. Common contributing factors are sympathetic nervous system activity, diabetes mellitus, sodium intake, excessive alcohol intake, secondary hypertension, elevated blood pressure commonly associated with another disease such as kidney diseases. Contributing factors: contraction of aorta, renal disease, endocrine disorders, neurologic disorders. Causes of hypertension: genetic causes. Some people are prone to hypertension simply because of their genetic makeup. Risk for hypertension increases if it has been observed in family previously. Environmental causes: noise, smoky environment, overpopulated homes. Risk factors for hypertension: the main risk factors for the high blood pressure are the following. Age: the incidence of high blood pressure increases with age and is more common above 60 years. As the age increases, the walls of the arteries become stiffer and less elastic. Also, fatty plaques develop in the vessels. Size and weight: obesity is a key risk factor. To reduce weight is the mainstay of prevention. Sex: males and females have equal lifetime risk, but men are more prone to hypertension at a younger age, while in older ages, women are more suffered. Other contributing factors include sedentary lifestyle, fatty foods, salt-rich diet, alcohol and tobacco abuse, medications, family history, stressful life. Read more about hypertension, causes, risk factors, signs and symptoms. /medicostuf.com